Drug Addiction and Communication by Dominic Perronie. The conversation about drug addiction in the United States has evolved over the years significantly. This reflects changes in societal attitudes, certain policies, medical understanding, and public health approaches. The medicalization of addiction. There's been a huge shift from viewing addiction as a moral failing or criminal behavior to understanding it as a chronic brain disease. This change is supported by increased scientific research which shows how drugs affect the brain's reward system, altering behavior and decision-making processes. The National Institute of Drug Abuse, or the NIDA, has been instrumental in promoting this view, emphasizing that addiction is a treatable medical condition. Of course, there's going to be stigmas that come along with addiction. There's been many efforts to reduce the stigmas that have led to changes, and these changes have discussed focusing on using person-first language rather than calling them a drug addict or a criminal. They avoid that negative labeling and to foster empathy and understanding. This linguistic shift aims to reduce the discrimination and shame associated with addiction. This will allow people that are suffering from addiction to come forward and seek for help and not feel as much shame as they do. Certain policy and legal approaches have also been in place. The conversation has moved from predominantly punitive approach to one that includes harm reduction strategies. This includes debates over decriminalization, safe injection sites, and the distribution of naloxone to prevent opioid overdoses. There's been a notable shift towards treating addiction as a public health issue rather than solely a criminal justice problem, which some states and cities implementing harm reduction policies as well. Public health and media narratives have also changed. Media portrayal of drug addiction has changed, particularly with the opioid crisis. Initially, drug use was often associated with criminals, but there's been a transition to narratives that portray drug users more as victims needing help rather than criminals. This change is partially due to a demographic affected by various drugs. For instance, the big one, the focus on the opioid crisis, which has impacted mostly white, middle-aged class communities. And unfortunately, that is what got the media's attention. It should not have been that way, but that's what got the media's attention. Looking forward to the recovery and the treatments, there are options. There's increased discussion about the diversity of treatment options based on traditional abstinence. Certain programs like Alcoholics Anonymous or Narcotics Anonymous, but they're not the only ones. This also includes medication-assisted treatments like methadone for opioid addiction, cognitive behavioral therapies, and holistic approaches to recovery. There are several options. The conversation now often includes harm reduction as a valid pathway towards recovery, recognizing that recovery might look different for everyone and each person is an individual. The cultural and social acceptance. Societal acceptance of discussing addiction openly has grown, with celebrities and public figures even coming out and sharing their stories about how they struggled with addiction. That has helped so many people because it made these people not feel alone. Public campaigns, educational initiatives, and community support systems are more prevalent now, aiming to educate about the risk of addiction and the realities of recovery and what recovery takes. Overall, the conversation has become more nuanced, emphasizing treatment over punishment, understanding addiction as a health issue, and advocating for a compassionate, science-based approach to dealing with substance abuse disorders. However, these changes are not uniform across all sectors, but we are making progress, and this progress is incredible to see. We will move forward and we will beat it.